Okay. Oh, wait. Yeah, people are slowly trickling in.
It's okay.
Yeah. Okay. Okay. So we'll start. Okay.
Okay.
Yeah.
I'm just waiting for your cue saying that you think most people are in.
Yeah. So I will do the introduction and then I'll give you the floor. Okay.
No problem.
Okay. So welcome. My name is Mary Vic Aplaon, and I am a counselor and recreation therapist here at AGI at the Alzheimer's Group Inc. For those who are joining us for the first time, here is a little bit of a background on AGI. Alzheimer Group is a charitable organization that supports families and individuals living with dementia. Our services include activities for people living with dementia, individual and family counseling, support groups, and educational courses and workshops. Lectures such as this one are made possible by the generous support of the Lassner Learning Center in the Lindsay Memorial Foundation. Before we begin, please note that while the chat feature is unavailable, there is a Q&A space for you to ask your questions. So you can just write them while we're having the discussion or the presentation, and we'll make sure to read it after. You may write your questions at any time throughout the presentation, and we will address them at the end. So today we are very honored to have Judith Dupras. Did I say it right?
Yeah, you did.
And Anna Vandalavski, audiologist with the RVO clinic, which is actually located here at 5555 Westminster. So the same floor as us. The RVO clinic currently has 9 offices and 5 service locations, including one just a few doors down from AGI, as I've said. Anyway, so I'll give the floor to Judith and Anna.
So hi, everybody. My name is Judith. I will be doing the presentation today. The only thing I want to rectify is that we are not audiologists. We are hearing aid specialists. So it's not quite the same amount of study. So this is why I just wanted to correct that part. So today I will be talking about hearing aids more on the counseling part of things, which means what I wanted with this presentation was to be very hands-on, not to be too general, but to show how to care for hearing aids, how to install hearing aids, how to change the wax filters, basically how to handle them from the beginning. So here we are. Let me just see if I can start this. There you go. So just to be sure that we are all on the same page, I will talk about the ear just for a little while. So as you can see here, you have the outer ear, middle ear, and inner ear. The vast majority of hearing losses occur in that inner ear part, okay? So if you have a hearing loss in the outer ear or middle ear, not always, but oftentimes there is a possibility to have like an operation to try and fix it or make it better. When the hearing loss is in the inner ear, that's where, right here, that's where there is no operation possible, okay? So the only thing you can do is having hearing aids, or eventually if your inner ear is very damaged, having a cochlear implant, which we will not really discuss today, okay? So first of all, what can cause a hearing loss? From what you can see here, the main reason for hearing loss is aging. So aging in itself is the main reason for hearing loss, just like for your eyes, where you end up having presbycia, where you cannot really see what's close, but you can see well what's farther. It's pretty much like vision loss due to age, where hearing loss due to age is called presbyacusis, okay, which is the equivalent. So second, you have heredity that does play a part, you know. Oftentimes, presbyacusis does run in the family. People will say, well, my mom, you know, had really bad hearing. And if you go back, you'll see that my grandmother or grandfather also, etc. What we see also a lot is when people have a hearing loss due to loud noise. Sometimes it's because you've been exposed to loud noise, like in a concert, but most of the time it's because you've worked in loud noise for several years, okay? Should it be the case, then you might be eligible for compensation by CNESST, which I will discuss a bit later. And also you can have different pathologies, which you can see down here, which I will not explain, you know, one at a time, but let's say that these are a lot more rare, and they can affect most of them the inner ear, but also sometimes the middle ear, where it would be important then to see a doctor because there might be an operation available. So basically, how does a hearing aid work? This is a very, 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 very simplified graphic of how it works. But basically, you have sound coming from outside that goes into the microphone of the hearing aid. Now, the part called amplifier does amplify the sound, but I will explain it in a little bit more detail. And basically, once it goes through that, then it exits from the speaker and it goes to your eardrum. Now, the amplifier part, what you have to know about a hearing aid is that it's a very, very powerful computer. A hearing aid will evaluate the environment around you thousands of times a second. And it will try to determine, is there a lot of noise, a little bit of noise? Is it calm? Are there people talking? Are you in a car? Are you outside, etc.? And once it has determined all that, it will try to adjust certain parameters to make sure that understanding speech is as easy as possible. Now, the higher end the hearing aid, the more parameters it can adjust. So sometimes people ask, well, for example, what's the difference between a hearing aid bought on the internet and a higher end hearing aid bought from a specialist? The one on the internet oftentimes are not really hearing aids, they are personal amplifiers. So what means is it exactly does only what you see on the graphic here, meaning sound comes in, goes up, comes out. Whereas that's not at all what a hearing aid does. A hearing aid will try and filter the signal coming in to try again and adapt to your environment to make speech as easy to understand as possible. Okay. Now, there are different programs that cover hearing aids. The main one is the RAMQ. Okay. The RAMQ will cover one hearing aid unless you are working, you are blind, you're a student, or you're a child. Okay. So if not, they cover one hearing aid. Does that mean that you only need one hearing aid? Absolutely not. Okay. Most people will need two, but only one is covered. We'll get back to that a little bit later. So in order to be covered by the RAMQ, you need both your ears to have a hearing loss. If you have only a hearing loss in one ear, you are not covered. So you need both your ears to have a hearing loss of a certain degree, which is 35 decibels, which will not tell you much, but you know, you need to have both of them. And when you take a test, the audiologist will tell you that you are covered or not. The CNESST is for what we discussed earlier, people that are working, who worked in noise, okay? So some people tell us, well, I did work in noise, but now I'm 87. Doesn't matter, okay? If you have worked in noise for several years, for example, you were working in construction, you were working in factories, you were a seamstress in a clothing factory, so lots of machines, one next to the other, etc. So all those things, even though you said, well, I was 30 and stopped working at 50, but now I'm 80, doesn't matter. You can still be eligible for that, okay? Again, when you take the test, it will be important when you take the hearing test to tell the audiologist that you did work in noise, okay? And then they will be the one that are going to help you start the process. Here at Réseau Vos Oreilles, we can help you. We have people to help you fill out the documents for the CNESST, since sometimes they're a little bit, they're not the simplest forms to fill. Let's just say that, okay? But we are there to help you. Now, ACC is Ancien Combattant du Canada. So if you were in the army and it was proven that you lost your hearing due to that, then you could be eligible. Affaires Autochtones, which is for First Nations people. PFSI is for refugees. Basically, it's a federal program for refugees that will cover hearing aids for them. And finally, we have private insurance. Now, most private insurances will cover some part of a hearing aid. Most of them will say we cover the cost of hearing aids up to 80%, well, for 80% up to $300. Well, the cheapest hearing aids are around $1,700. So you can just read that as we're going to cover 300. Okay. Some people have 500. I have very rarely seen more, but most of these, they cover at least something. Okay. So those are like the major ways of getting hearing aids. Now, I will be presenting different types of hearing aids now, just so that if you or a loved one are using these, you can recognize them and have a little idea of how they're working, okay? So the first one is what we call a RIC. This is what 80% at least of patients wear, okay? So you have a small hearing aid, okay, with
I'm sorry, Judith.
Yeah,
because I can only see
yeah.
a small part. You may, if you can you stop sharing?
Yes, no problem. Sorry about that.
No problem.
Okay, so now you might see me better. So this is a RIC. So you have a part that goes behind the ear, and you have a tiny wire with a part that goes in the ear. For example, oh, I removed I wanted to show you mine, but I removed it. On my ear, it's very, very invisible. Celle-là ici. Okay. So for example, I'm letting her put it in because it fits her ear, not mine. Okay. So right now she's wearing it. So you might think that you don't see much, which is exactly what the point is. Okay. So for discretion, merci beaucoup. So for discretion, this is an all-time winner for discretion and performance. So the hearing aid part is really this. Okay. So this is what's very costly. So this is the hearing aid. This is the speaker, okay, which can be separated. So the costly part, the important part is this. Now, these can be worn two ways. You can have, as shown here, you can have a part that is molded to the ear, or, thank you, you can have what is called a dome, which is the part here, or one like this, which is very, very flexible, okay? Depending on the hearing loss, depending on the comfort of the patient, depending on the dexterity of the patient, the hearing aid specialist will decide if they want to put this or this, okay? So the next one, let me just share again. Okay, so here you can see those are the domes I was talking about. A lot of different shapes here. And those are the ear molds we were talking about, the ones that are fitted to the ear. The one you saw was this one, is the smallest one. Again, with these, there are a ton of shapes, okay? And it all depends on the shape of the ear, the type of hearing loss, the dexterity of the patient, okay? So this is the second model, which is, okay, so this is the second type of model, which are the ones that are entirely in the ear, okay? So you have, for example, one like this, which is called a half shell, okay? So this is a lot bigger, okay? So this is a lot bigger. As you can see, it fills half her ear almost all the way to the top because, well, she has tiny ears. So, okay. So this one, tiens, enlève la dent parce que je veux pas te faire mal. Okay. And same type that goes in the ear is this one, okay, which is a tiny one, okay. Again, her ear is very small, so we see it maybe a little bit more than we should, okay, but it gives you an idea, okay. So this is, those hearing aids are a little bit more fragile than the ones we saw before, because if you, for the other one, let's say you break this part, then we can just put a dome while we wait for repair. This, if you break the shell, okay, there's no choice but to send it for repair. Also, newsflash, when you lose weight, you also lose weight in your ears, which most people don't know about. So it will change the shape of your ear. So oftentimes, we have people, they come and they say, well, my hearing aid's falling off. And we see that they've had this hearing aid for over a year. So why is it falling off now? We asked them, have you been to the hospital? They said, oh yeah, I spent 3 weeks in the hospital. I lost 15 pounds. Well, there you go. Okay. Even that will change the shape of the hearing aid. So for a dexterity point of view, since you only have this part to get in, it's a little bit easier. However, when they are molded to the ear, you do have the, the flaw that if you change weight, your ear changes shape, and they're more fragile. We cannot repair it as easily as one like this, okay? But for this one, well, the advantage is that it's almost invisible. Now, the next kind you have, let me share again. Okay, so next kind you have is what is called really the BTE, but those, as you can see, are very big hearing aids, okay? So those hearing aids, let me stop sharing again and show you. Okay, so this type of hearing aids, I know this one is red because it was a kid's hearing aid, okay? Usually they're not red. So those type of hearing aids, when they're this big, it's because they are for very, very, very deaf people, okay? This has about the output of the Metallica concert right in the ear, okay? So this is very powerful. However, you have ones that look like this with the tube that you can see here that are very much smaller. So they can be for more moderate hearing losses, okay? But it's just that for most people, they will prefer to wear this as opposed to this. But again, for some manipulation reasons, mainly, sometimes people are going to choose this instead, okay? Okay. So now I'm going to get into the very, very hands-on part, okay? So first of all, as you can see, hearing aids will have an indicator on them or flat out have like a color, not like the one I just showed, but more like, for example, when you have these, okay, which I will show from closer up. Sorry. Okay, so if you can see, you have one that has a right indicator and one that has a blue indicator. You can see red here and you can see the blue here. Okay, so what you need to remember is red, right. Okay, and since you only have two, the other one is on the left. Okay, or blue left doesn't really work. Okay, but a red right does. Okay, so the red one is on the right, the blue one is on the left. For another example, remember this one, it's red because it's going on the right. And since it goes completely in the ear, you will never see the red part. Okay, so the color is just for an indicator there. Now, let me share again. Okay, maintenance. Okay, so what you see here, okay, you have the spray to clean, and it's called daily cleaner because we highly recommend they are cleaned daily. And then, so you will have a little cloth. This, okay, is a pot for putting the hearing aids at night, okay? Meaning that you turn the hearing aid off and you put it in the pot there, okay, for the night, and you close it, and it's going to help to keep the circuit dry. So it will extend the life of the hearing aids. Last two things you will see, not a lot of people use them, just so you know it exists. There is a cream for itchiness. Okay, some people have like, they get itchy ears. And for the other one, it's like a little lubricant, especially for the hearing aids that are like the ones that go entirely in the ear. If people are having problem putting them in, but very seldom do people use that. The most important part is every night, okay, you need to spray on the towel and clean the part that goes in the ear, okay? Once you're done with that, you open the battery door if you have one, and then you put it in the little pot for the night. It will help extend the life of your hearing aids. Now, okay. Changing the filters, okay? There are a lot of different types of filters, and this is the part where, this is the part that people find the hardest on every type of hearing aids. So I will be showing them to you in detail, okay? First of all, for those big ones with the tube, okay, there is no filter, okay? So it's not for these that I'm gonna be talking now. Hearing aids of this shape, most of them will have, I don't know if I can move closer, a little white tip at the end. This is the filter that prevents the wax from entering the hearing aid. If my filter is too full, either I don't hear as well or I don't hear at all. It's the same as doing this, okay? Sound cannot come out. So people will say, I changed my battery and my hearing aid is dead. It's not dead, it's blocked with wax, okay? Now, in order to change it, I will show you different types, okay? The most common is some form of little box with little things like this, where if you look right, you have one side that has a new filter. You can see the white right there. And the other side has nothing. The other side is to remove the old filter. So you take the little stick, take the part that doesn't have the new filter on, you press it in the old filter, take it out, see, it came out, and then you flip it and put the new one in, okay? This one, same thing. Little white tip, you can see it very well against the red there, okay? Same thing. Some companies, exactly the same procedure, will have them with this shape. If I take one out, you can see you have two ends. So instead of being a stick, they just put it in a U form. So you have the new filter, and this other part is to remove the old filter, but it's the same thing. You will push in the old filter, take out, and push the new filter in, same thing. There's one last method which is a little bit less user-friendly. So this is why I'm going to take time to show it, because a lot of people have those hearing aids, okay? So especially if you have Phonak or Unitron hearing aids, okay? I still have a RIC. I have a little dome here. The wax filter is underneath the dome. So you need to remove the dome in order, sorry about that. You need to remove the dome in order to be able to change the filter. You will probably not be able to see, but deep inside you have a little white tip, so that's where the filter is. This company uses a disc. Now you need to turn it, okay, clockwise until you see that the one here, which is, if you can notice, a trash can, is empty to throw out the old filter. And the two here has a new filter, okay? So what you do is you plop it in. There's no way my hand is not hiding. I'm sorry about that. You plop it in the trash can. And when you click out, now the old filter will be in the trash can, and you can just click for the new filter. Now, after that, you need to put back a dome on it, okay? So this is the part where a lot of people have trouble with. There is a part in the middle of the dome inside to accommodate this. So you just need to push it in, okay? And now the dome is back on. So this is the harder part, I'd say, for this type of, when you have a dome, it's a little bit harder. So this is why I said, you know, earlier, depending on the dexterity of the person and everything, we can make different choices for the hearing aids. If you have a RIC, but you have it with the molded part, then the filter is right at the end also. So it's a lot easier, okay? Let me share again. Okay, batteries. So hearing aids can have batteries and they can be rechargeable, okay? So if your hearing aids are rechargeable, RAMQ does not give rechargeable hearing aids. CNESST does not give rechargeable hearing aids. Most of them will be acquired in private, okay? So if you have a rechargeable hearing aid, you do not need batteries, okay? You can see here, you have different companies where you can see the different chargers. It's all the same thing. You put them in at night. Next morning, you take them, you put them in the ear. Now, when somebody is, you know, living in is like either assisted living or CHSLD, or, you know, where you have other people taking care of them, but usually not the close family. What do we see often in my field is that, you know, it's never the same person taking, you know, the same orderly, for example, taking care of them. And so they will try and change batteries and they will break the hearing aids oftentimes, or that's even if they try to change the battery at all. So having rechargeable hearing aids then is very helpful because it's easy to use. You have like two holes and you just plug them in. Whereas with batteries, I will show you, but it's a little bit more complicated. So a lot of the times for this reason, I will recommend for people to get rechargeable hearing aids. And what I recommend to the family is you take a picture of the hearing aids inside the charger, you make it this big, and you stick it to the wall right next to the charger. So for them, it shows them this is how they're going in, and it's very easy to do for them. Okay. And next morning, when they come to get the person dressed, they can just take the hearing aids, put them in, and voila. Okay. Now, for the batteries, as you can see here on the left, you have 4 different types of batteries. No, they are not rechargeable, and you cannot get a rechargeable, just a rechargeable battery. Some exist in the 312, but they don't even last a day. So they can be used for other things than hearing aids, but not hearing aids, okay? Of course, the bigger the battery, the longer the battery life, okay? Most people have 312 batteries, by the way. I will show you how to change in the different models of hearing aids. So we're gonna start with the RIC, okay? Principle is always the same, no matter the company. Somewhere at the very bottom of the hearing aid, there is a little drawer that you can open, okay? Now let me hold it this way. So there's a little drawer that you can open, okay? Batteries, they all have, I'm not sure it's gonna show, I'm gonna take the big one, okay? They all have like a flat side and a round side. So if I hold it like this, okay, you can see it's not perfectly square. It goes like this. So in every type of hearing aid, let's start with the RIC, you need to put the battery flat side up, okay, meaning, see, I see the flat side, the whole of it. If I turn, then I have the bottom of the little drawer. Always important, you put the battery in the drawer, not directly inside the hearing aid. And then when I close the drawer, my hearing aid is on. If I want to turn it off, I open the battery door, okay? Now let me show you. When you have a hearing aid that looks like this, when you open it, okay, there is like a top and a bottom part. And you need to put the hearing aid, again, flat side on the top. Oftentimes, you will have trouble trying to fit the battery directly from the top, but the battery door is like open most of the time, so you can just like click it in from the side like this, okay? And then you close again the battery door and your hearing aid is on, and you need to open the battery door to turn the hearing aid off. This tiny one, okay? It also has a battery door, but it opens from the bottom up, okay? Again, inside you will have, you won't be able to see it, but there's a tiny, tiny, tiny drawing inside showing you on which side to put the battery. Technically, if you put the battery upside down, the door won't close, but there's always somebody that really wants it and closes the door anyway, okay? It's not that hard to close, okay? So just be careful because you could break the hearing aid, okay? And finally, you have that bigger one here. Always same thing. Here at the bottom is where you can open the battery door. There is a drawing at the bottom, okay? You can just not really see it because it's tiny, showing you which side you need to put the battery on, okay? And again, you put it in the drawer and you close, okay? So at night, when you go to bed, you open, okay? Now, let me share again. Okay, so this part, how to wear the hearing aid. You can see what they look like, okay? Most of them, what they look like once inside the ear. But what I would like to do here is more and show you how to put it on someone else, because oftentimes that's where people have trouble. Their caregivers, their loved one cannot put the hearing aid in anymore, and they need to do it, and it's not always easy, okay? So this is what I will be demonstrating with Millie, how to put it in for someone else, okay? I will stop sharing again, okay? So here you have Millie.
Hi.
Okay, so the hearing aids here have been molded to her ear. So this is why I'm able to do this. Now, the simplest one is the tiny one. Okay, so I will turn you right this way. Okay, so the red part Oftentimes, look at the white filter. That's the part going in first, okay? Then you will need to have which side is up, which side is down. On a molded hearing aid like this, when you have something written, don't need to read what it is, just to know it's there. Oftentimes, it goes to the front of the face. So in this case, see here you have something written down in white, meaning the hearing aid goes like this. Not like this where the writing, sorry about that, is this way. This where the writing is this way. I take the white part. This is what I put in the ear first. Now, you have to know that an ear canal is not straight in. It goes like this. So you start by pushing towards the nose, and then it's going to come back in after that. So if you're having trouble pushing in the hearing aid, now this one's it's already on the right place, but sometimes with elderly people, the ear canal has gone like, okay, you know, time, gravity, okay, so everything falls down. So the ear canal, instead of being nice and round, is like this, but very, very soft, okay, which means that if you pull on the ear a little bit, you will be able to open it again for the time to push the hearing aid in. So don't hesitate to pull on the ear, not down, not up, not towards the back, but towards the exterior. And then you can push the hearing aid in easier. You don't need to do it. Yeah, poor thing. I'm just like pulling on her ear and she's getting red. Sorry about that. Okay. So you don't need to push it. The hearing aid specialist will show you how far to push. It depends on everybody and on the type of hearing aid. It shouldn't be hard to push, but if you're taking the right angle, okay? So let me pull it out. I'm going to show you with the other one. Okay, so that's the one we did before. Again, white tip. If I turn, things written, which means that for her, it goes like this. Written part on this side, the side of her nose. So again, you put it, and if you look well, okay, it really follows the side, you know, the shape of her ear. Okay, I'm gonna take it off. I'm gonna show you for what is called the rick, okay, which is this. Now for this part, usually you want to hang it on top of the ear first, okay? So if you look well, okay, it's holding there, but I need to take this part now and put it inside. So you have the part inside the ear, the part on top, okay? So again, I'm gonna show you with one with the dome, but it's gonna be the same principle. I just put it on the top, and now I take the part with the dome and I push it in. Oh, I took your hair. There you go. I push it in, and especially the part with the dome, usually you won't be able to see it at all. Okay. And last but not least, okay, sorry about that. It's because it was made for other ear. Okay. You have the bigger one with the big tube. Okay. This one, you will want to get the molded part in first. Okay. So just like you would put this, but you have a hearing aid there. So you know it goes this way. So you know which way this is going. Okay. Sorry. Okay. And so there you have it. Okay. You put the part inside. It goes all the way through her ear up here. Okay. So again, the hearing aid specialist will show you how to do that. Okay. But sometimes it's good to have a little, a little video to show you how to do it by yourself after that, or maybe your loved one already has hearing aids and you're having trouble putting it in. As Marivic said, Anna is working a few doors down from there. So if you are having trouble, you can just go there and she will happily see you and show you how it's working. Okay. Now, Okay. Very fast. I'm going to explain to you what to expect when somebody first has hearing aids. Okay. So in the beginning, the usual problem, it's not that the patient thinks it's too loud, it's that noise is too present. Okay. It's like when you're driving your car, you hear your motor, but it's in the background. Okay. Until your motor makes a weird gurgle. As soon as that motor makes a weird noise, it can be very small. You're going to notice it right away. Okay. Why? Because we're animals. Okay. When our brain picks up a weird noise in our environment, it thinks it's a predator that wants to eat us. Okay. And it's going to react to it. It's going to notice everything. It's basically going to take the sound and put it like, really, really close to your attention. The problem is when you first go home with the hearing aids, for your brain, your fridge is a predator, your dishwasher, your clothing, your hair, the chair squeaking, the floor squeaking. Everything's a predator that wants to eat you, and it's going to be incredibly annoying. Okay? Why? Because your brain thinks you're in danger and you're not doing anything. Okay? So, first week is hell. It's hard. There's no way around it. First week, it's hard because your brain is going to react to everything. Okay. Just like somebody that has squeaky shoes. Okay. You're in a waiting room somewhere and somebody goes by and quick, and you're like, how the hell is this person handling this noise all day? But that person doesn't notice because for her, it's a normal noise. Her brain just forgets about it. Whereas you notice it. Well, it's going to be the same thing. The second week is not going to be as bad. And the third week, you start liking us again, which is why usually we want to see you after 3 weeks. Okay. So this is all a normal process, but that's a process where if this hasn't been explained well enough, people go home and they put in the hearing aids and they say, blah, I don't like that. No, because your brain's not accustomed to it. Okay. You have to realize that it's like when you go to the bathroom at night and you turn on the light and you're like, ugh, this is too much. Right now, it's fine. But now your ears have probably been in the dark for years and years and we're turning on the light. So you need time to adjust. Okay. This is very important. Usually, your hearing aid specialist will say, we each have our own recommendations for dealing with that. My personal one is to say, if you need to, just lower the volume, but as much as possible, don't take out the hearing aids, okay? Because even if the noises are not as loud in the beginning because you're getting the volume down, your brain's still getting accustomed to it, okay? So usually I tell my patients, you get up in the morning, you put on your eyes, your ears, your teeth, and you're good to go, okay? And at night, you remove everything, okay? So just 1 second. Oh, sorry, that was the wrong button. Okay, so exactly as I just told you, in the beginning, I tell them to wear them every day, but even after that, it's important to wear them every day. However, what I also tell my patients most of the time is that it is my job to make sure that you can wear them every day. Meaning, in order to ask for somebody to wear them every day, they need to be comfortable every day, okay? They need to be comfortable wearing them all day. So yes, there is a part where you need to get used to them, especially the first 3 weeks. But after that, we also have, after that 3 weeks, to adapt them to you if things didn't go too well, okay? So it's important if something's not right, go back to your hearing aid acoustician. It's super important, okay? Don't say, well, hearing aids are like that and I don't like them. No, go back. There are a lot of things we can adjust on a hearing aid, okay? And just, I'm not wearing them because I don't like them. It's on you. partly because you're not going back, but it's also on us. We need to see each other then. Very important. Hearing aids will stimulate your brain a lot, and that's very important. There is a direct link between hearing loss and not wearing hearing aids and Alzheimer's, dementia, anxiety, etc. Okay, so again, it's up to us to make sure that you can wear them all the time. But people say, I'm alone all day, why would I wear them? Wear them anyway. Okay, remember that little mortar, that little weird noise? Well, I don't have a hearing loss. I have the same thing with my fridge. I don't notice my fridge, but if it makes a weird gurgle, I'm going to hear it. Why? Because my brain is checking the sound of the fridge constantly, making sure, is it normal? Yes. No need to tell the girl up there. Is it normal? Yes. Is it normal? Yes. But the one time it's not, it's going to warn me. If you're not hearing your fridge, that's a lot of stimulation you're not getting. Okay. So even when you're alone, you need to wear the hearing aids. Now, I told you earlier that the RAMQ only gave one hearing aid. And I told you that ideally, most people will need two. There are some people who don't need two because one ear is dead, because one ear has the sound quality in it, what we call discrimination, very, very low. But let's say that in the majority of cases, people do benefit from wearing two hearing aids instead of just one. First of all, to know where sounds are coming from, you need two ears. Just like if you only have one eye, you cannot see in 3D. You cannot have depth perception with one eye. Even though this eye sees perfectly, you will not get depth perception. Well, with two ears, you need them when there's, for example, if there's more than one person talking, in order to triangulate towards one source of voice, you need two ears. Okay, there's nowhere around that. People will say with one hearing aid, well, when I go to restaurants, it's just like a mumble jumble, you know? Well, that's because you only have one most of the time. Okay, it helps stimulates your brain on both sides. It helps with the balance, etc. So most of all, it's really just pros and very few cons of wearing two hearing aids. Most cons being like the price. Okay, so just to end, little reminders. Okay, we don't wear hearing aids in the shower. We tell you to remove them before bed. Some people are like, oh my God, I forgot to remove them and I slept with them. That's fine, okay? It's your comfort. Most people will not wear them for bed. We like to let the ears, I don't want to say rest because of the sound, but more like humidity and stuff that could build up in the ear. We'd rather you remove them, but then even the shower, okay? Hearing aids are IP68, meaning that they are pretty good with water. You're not supposed to dip them in the water, but I mean, even I have forgotten and started my shower with them. Everybody does that. Dry them up, put them in the little pot I showed you for the night for a few hours and you should be good. If you're not, go back to your hearing aid acoustician. We just say, yeah, don't bring them at the beach or the pool. Same reason, so that they don't get in water. And at the beach, because, you know, let's say you have very, very, very fine sand, wind is blowing, sand get into places on hearing aids, and that's not good. So unless you have a very bad hearing loss, if your hearing loss is more like mild to moderate, maybe you don't really need them. Keep them away from animals. We see hearing aids chewed by dogs like so many times a year. Okay, we don't know why, but dogs love to chew on hearing aids. Maybe they hear them, you know, they're very high, they can be very high pitched where we can't. They smell like their owner. I don't know, but we see that all the time. And those little button batteries, very bad for a dog's stomach. So really, when you're not wearing them, put them either in the little case that they come in or in a closed pot for the humidity. What I do recommend, some chargers don't have a cover. a shoebox where you just put a hole for the wire and you can close the shoebox on top. Anything just to make sure your animal doesn't get there. Again, you disinfect your hearing aids every night. And if you think, I don't hear so good, the sound is weak, change the filter. Oh, my hearing aid is dead even though I changed the battery, change the filter. My hearing aid charged all night, it's not working, change the filter. Okay. And again, if there's any problem with the hearing aids, never wait and call us. Oh, but my appointment is in 3 weeks. Call. We will see you before. Okay. That's not a problem at all. So what you see here, we wanted to show you because, well, this, we are discussing people with Alzheimer's and dementia here. Okay. So there are some things to tie the hearing aids like this. Okay. I don't like the analogy, but that's pretty much the same principle as, those little clips for a baby not to lose his pacifier because it's on his clothing. It's exactly the same thing. Okay. Usually we do recommend that you, if a person is more confused, we do recommend that you put it behind the neck, you clip it there. So when the hearing aids fall off, or if they take them off, they're going to fall behind. So they're not going to keep pulling on them and throwing them, we don't know where, because they're going to be in their back. Okay. So that is, if you have a loved one that is consistently losing hearing aids, even with the hearing aids are completely in the ear, there are ways to tie them. Okay. So talk to us about it. Finally, some hearing aids, especially the hearing aids in private, they do have what we call a loss and damage warranty with the hearing aid company, which is good once within a certain span of years. But some lower grade hearing aids don't have it at all. And we do recommend for everybody that you call your home insurance when you get the hearing aids, and you make sure that you are insured. That sounds very bad, but anyway, so just make sure that you are covered in case of theft and loss. Theft, you are probably already covered and you will not have them stolen, but fair chances are you will lose them. Okay, especially since we're talking about a clientele with Alzheimer's and dementia. But trust me, even people without it do tend to lose their hearing aids. And it should be covered on your home insurance already, but please check right when you get the hearing aids, because it's not once you've lost them that you want to discover you were not covered. Okay. And so this is it for today. Again, I really wanted to do something that was very, very about the practical side of hearing aids, how to handle them, how to clean them, just for the purpose of helping caregivers that you are not as used with hearing aids as others to be able to handle them. But we are planning maybe a second webinar where we would be talking more about the science between hearing aids and direct link with the brain and everything, which I've talked about very, very shortly today. So Le Réseau Vos Oreilles, we have several clinics. The one that is closest to you is the one where Anna is. And it's really a few doors down on Westminster, so in Côte Saint-Luc. But if ever you need to reach out to, because you're not from the Côte Saint-Luc, La Chine area, we do have other clinics, especially in TMR, downtown, or Ile-Perrot, etc. So I hope you enjoyed this. I don't know if people had questions.
Yes, actually, they have some questions, Judith. So
Yes.
if we could just can we stop sharing so that we could all see?
Yes,
Yeah.
sorry about that.
No problem.
Yes.
Yeah. Okay. So my first question though is that do we need, if our clients need a hearing test or something, do we need referral from the doctor, or can we just call you straight?
Okay, good question. You do not need a referral for a doctor. In the clinics, you can do tests in private. The test is $100, so it's a little bit less than a vision test. There are free tests that you can have at the hospital, but then you need a referral from the doctor. And I think depending on the hospital, the waiting is like 9 months or something. It's very long. So usually people will get them in private because it's a lot shorter waiting. And since it's not like that costly, usually they will get it. And no, you don't need any referral at all. It's usually people will call, the first thing they're going to ask is for a hearing test. Now you have to know that it is the law that in order to provide hearing aids, we need to have a hearing test that is less than 1 year old. Very important, okay? So people, yeah, but it's like, it's been 1 year and 2 months. It's too late, okay? We need a new test then. So less than 1 year old. And also in order to provide hearing aids, we need tests that is going to be done by an audiologist, okay? So, because we cannot, we know how to do tests, but the principle here is that just like for the eyes, the person that is telling you you need a hearing aid is not the one selling them, okay? So it's really two separate things, although we are often in the same offices.
Okay, thank you. Okay, so for another question that they have in here is that my mother has 2 different hearing aids,
Okay.
and the sticks are different for each.
Oh, okay.
Her provider does not carry the correct size to remove the
Oh.
filter from one hearing aid. What can I do?
Okay, that's a hard one. First of all, yeah, a lot of people will end up having two different hearing aids, and so 2 different filters. Usually, though, the provider will carry these. I don't know what provider it is. I know that here I haven't had any type of hearing aid that I didn't have the little stick for. Okay, so there's something going on with that. Let's say that if you want to buy some, you can always come at our one of our clinics, and we'll sell you some. That's it. But it's not very costly. But usually your provider is supposed to have all the sticks for all your hearing aids.
Okay. So other question is how often should we change the filter?
Okay. The how often question is a very hard one because everybody is different. The reason why I'm not able to give you a time frame is because some people make a ton of wax, some people make no wax, okay? So usually rule of thumb is once a month if you did not need to change it before. But when I say once a month, does not mean that after 2 weeks, it cannot be plugged. Absolutely not. It's just that if you had a need to change it for 1 month, change it after a month, because fair chances are it's at least partially blocked. Okay. So then you know that your hearing aid is always working as best as possible. But I've had people say, well, my hearing aid cannot be blocked. I changed my filter 3 days ago. It can be blocked. Okay. Does that happen often? Absolutely not. But some people make really a lot of wax.
Yeah. Just to realize that. Yeah. Okay. Judith, another question is like, can you repeat what the gel lubricant is for?
Oh, okay. So if you have a hearing aid, let's say again, like this one, okay? In order for it not to fall off of the ear or to make weird noises, it will happen that it might be a little tight and hard to insert. We don't see it that often, but if it happens, then there is a little lubricant, a little gel that you put a tiny little dot on it, and you just rub it, and then, okay, it just goes right in. That's why it's there. But I'll be honest, I think I sell like 1 gel every 3 months. Okay, so it's really not something you use a lot. Sometimes more with kids, because kids, we need to make the mold tighter because they grow up fast. So it needs tighter in the beginning sometimes, but we really don't see that often.
Okay. One last question, Judith, if you could actually demonstrate to us how to change a filter one last time.
No problem.
Yeah.
Okay. So again, I know the filter is the hardest part for any caregiver. So with pleasure, I'll repeat it again. It all depends on the type of hearing aids. So again, one type would be where you have a molded piece and a little white dot. It can be either like this, or like this. Sorry, the white dot's missing right there, but normally you have it on this, which is a rick with a molded tip. Okay. Now you have sticks that looks like this. Let me put it against the white. Okay. So you have sticks that look like this. Different companies have different shades of this, and they can look different sizes, but the principle is always the same. You have a stick. When you take it out, this I'm going to put against, yeah, this white part here, this darker part, you can see you have a white tip on the one end, and on the other end, you have nothing. Okay. So the white tip you see is the new filter. So you take your hearing aid, you take the side that has, you take the side that has nothing. Okay. And what you do is, I'm going to put it against I'm trying for you to see, and it's not easy because one part is white, one part is dark. So you just press the part that has nothing inside the white dot. Okay. See, it's even going to stick. You don't need to turn, don't need to do anything. You just pull out and see that old filter came out. And then you turn and you put the new one in. Okay. Now you've changed the filter. If you have more of the Audicon family, okay, Audicon, Sonic, Bernaphone, they're going to look like this, but it's the same thing. Instead of being a stick, it's a U. Okay. But imagine like it's a stick that they took and they did this. So one end to remove the old filter. Here you can see that you have the new filter, but it's always the same thing. I just cannot really do it because it's not the right brand, but you stick in the old one, you take it out, and you push the new one in. Lastly, and this is the most complicated one. Sorry, I'm just stealing her hearing aid again. Okay. You will have a little dome on it. Okay. So this, imagine you have a rig with a dome. Okay. Either when you take it out, you're going to have the same white tip as with this, you're fine. If you have a Phonak or a Unitron, and a lot of people do, okay, this, once you remove the dome, deep inside, and I don't think you can really see it, there's a tiny white tip inside in this case. And you need to change it with a little disc. So this disc, okay, I used it before. So if you look at the one that is like a trash can, there's already a filter inside. And at position 2, you have nothing, which means it's already spent. You need to turn the disc until the 1 is empty and the 2 has a new filter. So 1 is the trash can, the 2 is the new filter. So what you do is this, I'm going to put it like this. You're going to plop in the trash can. It's going to go click. When I remove it, I now have my filter in. And now I need to get the second, go in 2 for the second part and take the new filter in. See, it's gone now. And then put the dome back on. Okay, so that's pretty much how it goes. But I know this part is always complicated. Again, if you're having too much trouble, do call your provider, get an appointment so that they can show you again. Okay, and never hesitate to do that because that's what we're here for. Okay, so I don't know many providers who are going to complain that, you know, patients have a problem and they're calling me. That's what we're here for. We'd rather you call when you have a problem than just to wait and, you know, be mad because it's not working right. If there's a problem, you need to call. Okay?
Okay. Well, Judith and Anna, thank you very much. That was a very informative presentation and a really,
Thank
really
you.
helpful in a practical way. Because
That
you
was the
really
point.
demonstrated it. It's like it's great. So we're looking forward to hearing from you again about
Thank
the
you.
about really the significance of hearing loss in dementia and the science behind it. So thank you very much for all our audience for this afternoon. Thank you. If you have any questions, just send us your questions at AGI at 514-485-7233, or you can email us at info@agiteam.org. And again, Anna and Judith, very many thanks. Merci beaucoup.
Thank you very
you.
much. You have a good day.
Bye-bye.
Bye-bye.